of times when women go to a fertility center, it's just do whatever you can to basically force your body to getting pregnant. And it's not always with the focus of quality. It's just getting pregnant, staying pregnant. But outcomes can be really improved when you focus on the quality of the eggs. And also, that can help not only increase the likelihood of getting pregnant, but staying pregnant, having a healthy pregnancy, and having a healthy transition to the postpartum phase. Hello, my friends. Welcome back to the show. Wanted to do something a little different today. I'm going to be the guest, and I have the lovely Kristy Crandell. She is our nutritional coach at Shine. She's joining us today, and she's going to help kind of be like a substitute host and interview me, and mostly just so it's not just me talking to you guys, so it flows a little bit easier. But as you may know, I'm pregnant. As I'm recording this, I'm just entering my 9th month. So I'm big and a little bit tired and feeling pretty good overall. So I wanted to just hop on and just share some things about my experience with getting pregnant in my 40s. And I'm going to just toss the baton over to Kristy and let her take over.
Great. Well, this is so fun. I always love coming on here and interviewing, being on this side of the table and interviewing you. So Dr. Noel is not only the founder of this show and a licensed naturopathic doctor with over a decade of experience in women's health, but she's currently 9 months pregnant with her second baby. So I'm excited about this episode. We're really going to be kind of pulling the curtain back and looking at Dr. Lowe's personal journey, how she's prepared her body and mind to conceive in her 40s. And she's going to give you some great tangible things that have worked with her specifically in supporting getting pregnant and supporting a healthy, vibrant pregnancy. So for those of you who are new to the show, Dr. Noel, aka Dr. Lowe's, what we call her, is a licensed naturopathic doctor and expert in natural medicine. She has received her doctorate from National College of Natural Medicine in Portland, Oregon. Since 2010, Dr. Noel has treated over 5,000 patients using natural therapies. And her area of expertise include natural fertility, thyroid and hormone health, digestive disorders, and autoimmune conditions. She is a frequent lecturer on health radio shows and at medical conferences, and she is the host of the Dr. Lowe Show, which is the top-rated podcast on iTunes that has attracted over 3 million downloads. Dr. Noel owns Shine Natural Medicine, which is a virtual medicine practice, and we offer naturopathic medicine, nutrition coaching, nutrition coaching to patients all over the country. So, Dr. Noel, first of all, congratulations. You are glowing. You are glowing, by the way.
With the natural lighting coming in from the window. Thank you. Appreciate it. And my copious pregnancy hormones.
Yes. How does it feel to be in your 9th month in your 40s compared to your this is your second pregnancy? How does it feel compared to your first?
I had my first at 38, and I actually conceived as I was finishing up my fertility course, Golden Eggs, which is pretty cool.
Wow.
And also our nutritionist that we were working with at the time, now she's full-time mom. She was also, she had been diagnosed with premature menopause, and she got pregnant as we made the program together.
Wow.
So this stuff really works. I really believe in this. And so I felt good in that pregnancy. I have felt good in this pregnancy as well. I can tell there's a little bit of a difference being pregnant in my 40s, just a little bit more tired and a little more achy and stuff like that. But for the most part, really good. But I also have had a lot of life that's happened from then until now, a lot of stressors. I had mold exposure. I became a widow and then got married, and a lot of life has happened. So, I'm sure there's factors, but overall good.
Good. That's amazing. And I'm sure that's really good to hear for other women who may be in their 40s and hoping to conceive. And so let's kind of dive into some practical side of things. How did you prepare your body to conceive naturally at 44?
Yeah. So a lot of it is just my lifestyle that I just try to live anyway. I think living like a naturopathic lifestyle is naturally a fertile promoting lifestyle. And I try to teach that to patients that when we focus on your own health and getting your body into balance, fertility is a natural side effect. However, I do think that there are some specific things that you can focus on even more so when you are trying to prepare your body for pregnancy, just more intentionally. So that's what I wanted to share today. I think first off, like I said with my program that I created, Golden Eggs, the focus with that was on egg quality, and that's an
Mhm.
area of focus that is oftentimes missed in the fertility world. When a lot of times when women go to fertility center, it's just do whatever you can to basically force your body to getting pregnant, and it's not always with a focus of quality. It's just getting
Mhm.
pregnant, staying pregnant. But outcomes can be really improved when you focus on the quality of the eggs. And also, that can help not only increase the likelihood of getting pregnant, but staying pregnant, having a healthy pregnancy, and having a healthy transition to the postpartum phase. So that's something that I had a bit more of a focus on. Once I got remarried, my husband and I tried for about 5 months, and then we ended up getting pregnant. And so I wanted to talk about the supplements that I took specifically. Now, this isn't necessarily saying this is going to work for every person listening. Everybody is different. I do run testing. We'll talk about the labs that I ran on another segment, but I did run a micronutrient panel and it showed what I was deficient in specifically. So, but the things that I'm going to go over are found to be beneficial in the research from a fertility perspective. So, first thing, focusing on egg quality, was I took CoQ10. I took it in the form of Ubiquinol. And me personally, I took 200 milligrams. Typically, it's
Mhm.
dosed to 100 to 600 milligrams, just depending on your levels and how you test. And this also can be used for men as well. So I started taking that, I would say maybe 3 or 4 months prior to getting pregnant, is how long I took it. And research does support using CoQ10. So it's been shown in animal studies to restore ovarian reserve and improve egg quality in aging mice. I know I'm not an aging mouse, but aging is aging.
Mhm.
And how it works is it improves mitochondrial energy production, which the mitochondria, those are little powerhouse uh, portions of the cell that make energy, and it's a really important component of eggs. And so it basically helps the eggs to mature properly. So I started taking that. And then I also was taking DHEA as well. So DHEA,
Mhm.
not the same as DHA, which is an omega-3 fatty acid. DHEA is a hormone made from your adrenal glands. And it does naturally go down with age. So as we get older, it
Mhm.
goes down. Stress and sleep deprivation can make it decline. When you have low DHEA, oftentimes you can have low sex drive, low mood, low energy, feel like you just don't get great results from your workouts. Um,
Mhm.
and I tested to be low in that. So I was taking it, I think I was taking about 10, 15 milligrams. So not a super high dose, but for women who have low ovarian reserve, so let's say they do an AMH and it's found to be low, like I would say below 1,
Mhm.
going on DHEA can actually really help to improve that. And I've seen that with many of our patients. So 25 milligrams up to 3 times a day is the dose that we'll do for some of our ladies with a low AMH. But me personally, I was taking about 10, 15 milligrams, and I did find that it helped sex drive, it helped energy, helped my mood. I noticed a benefit from taking it.
That's great.
So those I was taking, I was actually taking DHEA for even longer, probably like a year or so.
Okay.
Once I got pregnant, I stopped taking it. So those are two, CoQ10, DHEA. I also started taking Myo and D-Chiro Inositol. So there's a mouthful. We'll put all this in the show notes so you can see how things are spelled. But it was in a 40-to-1 ratio, and that ratio is important. Myo-inositol and D-Chiro-inositol, they are two naturally occurring forms of inositol. It's like a vitamin-like carb compound that helps with fertility, mainly by improving insulin sensitivity, hormone balance, and egg quality. So, especially in women with PCOS, which I had been
Mhm.
diagnosed with PCOS in the past. So, PCOS stands for polycystic ovary syndrome. And the root of PCOS is blood sugar dysregulation. So, oftentimes, by really focusing on regulating the blood sugar, the PCOS symptoms really, really improve and really improves
Mhm.
being able to conceive, ovulate properly and conceive. So, how it works is it improves insulin sensitivity. So they work like insulin sensitizers by working as secondary messengers in insulin signaling pathways. So why that matters is high insulin can disrupt ovulation, and it can cause irregular cycles and also increase androgen levels like testosterone, which can impair follicle development. So research shows that myo-inositol supplementation improves ovulation frequency and lowers insulin resistance in PCOS women. So it's really effective for that. And I
Mm.
really believe that if I were to pick one supplement, I think that one would have been the one for me, because I do think
Mm.
that was more of like the root of hormone issues that I was having. I was having like symptoms of like losing hair kind of in this area,
Mhm.
getting a little bit of acne. I used to have a lot of acne back in the day, but I was getting like hair on my chin and my lip. I would have to like pluck or shave
Mm.
it.
Mhm.
Just easier to put weight in the midsection. I was just having a lot of symptoms of PCOS, like late ovulation. My cycles would be a little bit longer.
Mhm.
So those are common symptoms with that. And so, yeah, so mine also helps to normalize the hormone signals from the brain to the ovaries, like FSH and LH specifically. So if you run a hormone test and see that you have really high LH compared to FSH, that can be
Mhm.
a strong clue that you have PCOS. So normally FSH should be 3 times higher than LH. That's the
Okay.
ideal, what it looks like. And it's actually kind of rare to see the ideal for most women.
Mhm.
Oftentimes, if it's pretty balanced, it's like a 1 to 1. But with PCOS, it's flipped, and that was the case for me. I had much higher LH to FSH, and so studies show that improved regularity and spontaneous ovulation rates happen after 3 to 6 months of use with myo-inositol and D-Chiro. So it improves egg quality in IVF patients. It's been shown to improve mature eggs, so oocytes,
Mhm.
better embryo quality, and reduce the total gonadotropin dose that was needed as well. So pretty cool stuff. A 40-to-1 ratio showed better pregnancy and live birth outcomes in IVF compared to just myo-inositol alone. So doing the
Wow.
combination is especially good. And there's also antioxidant and anti-inflammatory benefits too. So reducing oxidative stress, basically aging in ovarian tissue. So which is really important in women over 40 when
Mm.
oxidative stress is higher and egg quality naturally declines. That's a big reason why fertility declines, is just that oxidative stress that happens
Mhm.
with the eggs. So anyway, that's a nice little commercial for Myo and Deco.
Yeah. It's amazing.
Yeah, really cool stuff. Another one I did was NAC. So NAC stands for N-Acetylcysteine, which is a precursor to making glutathione. So we've talked a lot about glutathione on the podcast. I have a love
Mhm.
relationship with glutathione. I did a lecture, like a report on glutathione when I was in my community college years before going to medical school. I did a whole thing on glutathione. I'm such a dork, but I've been in love with it ever since. But I personally am kind of sensitive to glutathione. I'm a little sensitive, just processing, and I think genetically I have certain mutations that I don't
Mm.
feel it that great. So NAC actually do really well with. And interestingly enough, NAC supports fertility through multiple mechanisms. So especially for women with PCOS,
Mhm.
or recurrent pregnancy loss or age-related egg quality decline. It helps to boost glutathione, which helps to reduce aging and oxidative stress of the eggs. And as I said, eggs are very sensitive to toxins, to oxidative
Mhm.
damage, and it really helps with that. So conditions that are inflammatory, like PCOS or endometriosis, can really benefit from NAC. And let's see, also improves insulin sensitivity as well. So in PCOS, NAC can help to normalize menstrual cycles, reduce androgen excess, like I said, high testosterone, and restore ovulation. So there's a randomized trial in PCOS women that found that NAC improved insulin sensitivity and ovulation rates. So sometimes as effectively as metformin, which is used
Wow.
for PCOS. Yeah.
Wow.
Also lowers androgen levels, so excessive testosterone in women, like I said, can disrupt follicle development, so it helps to reduce that significantly. And it also can reduce CRP, which is an inflammatory cytokine, that can create, if you have high CRP, it's a clue you have high inflammation, and that just
Mhm.
creates more of like a hostile environment with your eggs. And so it helps to reduce that significantly, which can help to improving implantation and reduce miscarriage. Also, what's really cool about NAC is it has what's called a mucolytic effect. So muco, like mucus, lytic means
Mhm.
through, so it cuts through mucus. So it can thin the mucus, and that makes the cervical mucus more hospitable to sperm. So if you pick our
Okay.
mucus, it kind of works like a shield. So by thinning that out, it allows sperm to reach the egg, which is always cool. So
Great.
that improves uterine blood flow and also improves endometrial thickness, both key for implantation. And it's also been shown to reduce miscarriage risk. So NAC has been shown to improve live birth rates in women with a history of unexplained recurrent miscarriage, likely due to antioxidant and anti-inflammatory effects. So
Amazing.
really, really good stuff. For NAC, I think I took 600 milligrams twice a day. That's what I took. But
Okay.
take 900 milligrams twice a day. But I also was testing my levels, and I found that I was low. So I think that's really important. It's
Mm,
super rare that someone has good levels, though, I will say. It's super rare
okay.
that I see someone with good levels of CoQ10 and
Mm.
also inositol. We check that for every patient too. And I don't know, not even 1 out of 10 times does someone have good levels
Wow.
of those nutrients. Like everybody is low pretty much,
Yeah.
and glutathione too. So if you're not sensitive
Mhm.
to glutathione, I would probably do NAC and glutathione.
Okay. Do both.
Yeah, so I mentioned CoQ10, DHEA, Myo and D-Chiro Inositol, NAC. And then the last supplement that I took was Vitex. And this
Okay.
one I started probably about 6 months, I would say, before
Okay.
positive pregnancy test. So Vitex, also called chaste tree berry, supports fertility primarily by gently rebalancing reproductive hormones, especially in women with luteal phase defects, irregular cycles, or estrogen progesterone imbalances. So for me personally, I had a shorter luteal phase. I would ovulate pretty late, like around 18, 19, 20. And then I would have
Mm-hmm.
a shorter luteal phase and then my period would start. So Vitex is a good thing to think about if that's what your pattern looks like.
Okay.
And I also had really high prolactin, which is associated with low thyroid, but that tends to be a common pattern that we see with PCOS. And Vitex can be helpful to lowering that. So
Okay.
Vitex is one you have to be a little bit careful with if you have PCOS, because some data shows that it can possibly increase LH a little bit. So I just decided for myself it felt right and I did it and it worked out.
Mm-hmm.
So I would, definitely talk to your healthcare provider if you're not sure about it. But what
Mm-hmm.
Vitex does is it supports progesterone production via the pituitary. So the pituitary is a little gland in your brain. It produces hormones. It produces LH and FSH, and it talks to the ovaries to make hormones, basically. So Vitex doesn't contain hormones, but instead it acts on the HPO axis, so the hypothalamic, pituitary, ovarian axis, and it just improves the communication with that. So it increases LH release and mildly suppresses FSH. And this shift can help with ovulation. It can help produce higher progesterone production, stronger luteal phase support for implantation. And why it's important for women over 40 is because luteal phase progesterone, it declines with age. So our progesterone declines
Mm-hmm.
typically in our mid 30s. And I definitely was running low in progesterone. And so it just makes it harder to ovulate and also support a healthy pregnancy. So progesterone helps you to get pregnant and stay pregnant.
Mm-hmm.
If that's low,
Right.
then it just makes it harder for those things to happen. It normalizes prolactin levels. So like I said, elevated prolactin can disrupt ovulation and shorten the luteal phase, which was the case for me. So it helped to reduce that excess secretion of prolactin. And in women, this was a study that found that in women with luteal phase defect and high prolactin, Vitex normalized prolactin in 85% of the cases and
Wow.
restored luteal phase length. That's crazy.
That's a good,
If there was a
yeah.
drug that did that, it would be flying off the shelves.
Mm-hmm.
Really powerful stuff.
Yeah, I mean, this is such good, valuable information, that people can take these natural routes to help strengthen their fertility. So it sounds like you were taking a lot of these supplements about 6 months before you found out you were pregnant.
Yeah, probably 3 to 6 months.
Okay. And if someone's hearing that, oh, I'm hoping to get pregnant in a month. Would you say it's still not too late for them to start taking some of these supplements to strengthen that for them?
Probably not too late. But in order to improve the quality of the eggs, it takes a good solid 3, 4 months, I would say.
Yeah.
And same
Yeah.
thing for sperm health too. Men make new sperm
Mm-hmm.
that often. So, if you and your partner can get on board with doing these things together, my husband he takes a ton of supplements on his own. And
Hmm.
he doesn't have like the healthiest lifestyle or diet, but he loves his supplements. But I think it probably helped with sperm quality. Maybe I'll have him on and he can talk about his,
Yeah.
I'm sure he'd be into that.
Yeah.
But yeah, give
So,
yourself some time if you can.
okay. So at least 4 months. It's
I would
really
say
to
that.
improve
Yeah.
egg quality. And when you found out, when you got the positive pregnancy test, did you stop some of those supplements? Did you continue taking them? You
Great
know,
question. That's a really good question. So I stuck with the Myo and D-Chiro Inositol. I've been doing that throughout. Sometimes I forget. I'm not great about
hmm.
supplements sometimes. But I did stick with that. And that's because it's safe in pregnancy and it also is shown to reduce gestational diabetes and preeclampsia. So there's
Oh,
benefits to
great.
do it during pregnancy. CoQ10, I've stuck with that. I reduced that to 100 milligrams, but I did stick with that. I stopped the DHEA. I continue with the NAC that I brought down, I think, to just 600 milligrams. And
Mm,
then the Vitex, I think I did the Vitex for the first trimester, I want to say.
okay.
It's kind of a gray area. So I would talk to your doctor about that.
Hmm.
I was going to talk about this in another segment, but I did take progesterone as well during
Okay.
leading up to getting pregnant. So I was tracking my cycles, and we'll talk more about that. But I was tracking my cycles, and when I would get the positive ovulation, then I would start about 2 to 3 days later. I started progesterone. I did that for like 2 weeks, and then I
Hmm.
would stop. And then, it just was helpful, I think, for kind of normalizing my cycles. And then
Hmm.
when I got a positive test, then I just stuck with it and I continued taking progesterone for the first trimester. So I did that as an oral supplement, or it was a medication from a pharmacy. And then I also did progesterone suppositories as well during the
Okay.
trimester.
And that was a bioidentical form of
Yep.
progesterone.
Yep.
Okay. And was that based off of a hormone panel you had run on yourself
Yep.
too? Okay.
Mhm.
So yeah, that's amazing, and it's probably really good for a lot of people to hear these things because I think when you talk about pregnancy, a lot of people are scared of supplements, because a lot of doctors will tell them like do not take anything when you're pregnant and all that. So it's really nice to hear your side of this and hear the safety and the efficacy of some of these supplements and supporting not only natural conception but also are safe during, some of them are safe during pregnancy.
And it's also important to understand the source of who's telling you that. If they don't have any training in it, they're always going to want to cover their butts and err on the side of caution. So
Right,
they'd rather
right.
you take nothing than take something and maybe screw up, your case. So
Hmm.
just important to know that they may not be trained in it necessarily.
Yeah,
So
yeah. But obviously, if you're going to take any of these supplements, you do want to let your doctor know, talk to your doctor about it as well.
yeah, you do, and take their opinion with a grain of salt for sure. No
Hmm.
disrespect, but it's good to, if you want to get guidance on supplements, talk to someone who has training in that. It's like common
Right.
sense, but it is worth mentioning. So yeah, so those are the supplements that I took: CoQ10, DHEA, Myo and D-Chiro NAC, and Vitex. But for you, there might be something different. Maybe resveratrol is the thing, or maybe, doing a B complex, maybe taking
Hmm.
chromium or doing zinc, or, it could be completely different than what I took. But as you
Hmm.
can see, these different supplements have a lot of data in the research that do show improvements in outcomes. So just wanted to
That's amazing.
you guys.
Great. What other kind of lifestyle as well, non-negotiables did you have when trying to conceive?
Yeah. So do you want to get into the rest of the things now?
Yeah, let's
Okay.
dive into it.
All right,
Yeah.
cool. So, overall, I was thinking about this and I was thinking, okay, how can I just pare this down and try to make it a little more organized and simple? And there are probably 7 different strategies that I felt helped me get pregnant at 43. So I got my positive pregnancy test a month before turning 44. Actually on Christmas Day, which is super cool. So
Oh,
I'm gonna
amazing.
show my husband that on Christmas. It was a cool gift. But I turned
Hmm.
44 on January 24th, so almost exactly a month later. And so, aside from the supplementation, a few things. One was just focusing on hormone balance. So me personally, I had low progesterone. I also have had a history of an underactive thyroid even since high school. I tested
Mhm.
low on thyroid. I never have had a positive test to show that I have Hashimoto's, but my mom and grandma both have it. So I might be one of those that just have a negative antibody that still has Hashimoto's. There's a small percentage of people that have Hashimoto's despite negative thyroid antibodies. So it's definitely possible. But what I did before getting pregnant, I think that helped was going on the progesterone in my luteal phase and then also
Mhm.
getting my thyroid more balanced out. So my TSH at one point was like 20. It should be between like 1 and 2.
Okay.
And then as I worked to adjust my dosing on thyroid medicine, I was able to get it, I think, down to like a 4. So it still
Mhm.
never got perfect. And so I think that's important to note that, perfection doesn't always need to be reached before getting pregnant, but it significantly got better. And I think that really helped. What we know that women who have a TSH over 4, it actually doubles miscarriage risk. So getting your thyroid balanced out is really important for getting pregnant, staying pregnant. Um,
Mhm.
it's needed in order for ovulation, implantation, and maintaining, early pregnancy, especially. And one thing important for that is if you're on thyroid medication and you get a positive pregnancy test, it's important to go up on your dose right away because
Okay.
oftentimes the thyroid can take a dip in early pregnancy. So I increased it by, I think it was like 30-40%, like right off the bat.
Mm.
And I think
Okay.
that was really important for me. So yeah, thyroid optimization. Ideally, you want to get your TSH between like 1 and 2 or 1 to 2.5 for fertility, but do the best you can. And
Mhm.
and progesterone support during the luteal phase. So that I think was really key for me. Women with optimal mid-luteal progesterone have significantly higher pregnancy rates. So the word
Okay.
progesterone comes from progestation hormone. Gestation is getting pregnant. So even just
Mhm.
in the name, it tells you what it does. And then also a big thing that I did is I really focused on sleep. Um,
Mm.
I can't say with honesty that I had low stress when I got pregnant. My stress was pretty high. I was newly married,
Mm.
just learning to dance with my new husband, and
Mhm.
big difference from my previous marriage to my current marriage. It was a big lifestyle change. My son all of a sudden got 4 siblings. We moved into a new
Mm.
house, changed location, changed residence, and it was a lot of moving parts. So I can't say that I had low stress, which is kind of cool.
Yeah.
I was dealing with stress and I still got pregnant. But one thing I
Mm.
did focus on was my sleep.
Mm.
And, sleep is really a surprisingly powerful fertility booster, especially in your 40s. When egg quality and hormone resilience are already more vulnerable, so it just becomes even more critical. So, a
Mhm.
little bit about sleep, I wanted to share why it matters because during deep sleep, your hypothalamus and your pituitary glands coordinate the release of reproductive hormones. So, you release something called GnRH, which is gonadotropin releasing hormone that controls the release of FSH and LH, which if you remember, that's involved
Mm.
with the ovaries doing what they got to do. So FSH, which stands for follicle stimulating hormone, it stimulates follicle growth and egg maturation, so the egg's maturing, and then it also produces LH, which triggers ovulation. So when you have poor sleep, it really disrupts these rhythms and it can lead to
Mhm.
irregular cycles. It can lead to skipped ovulation. So in women 40 plus, hormone rhythms are already more fragile, due to perimenopausal changes. And I do believe that I was entering perimenopause when I got pregnant. So you can definitely
Mm.
get pregnant during perimenopause and stay pregnant.
Mhm.
Giving a little bit of hope out there. If women are listening, going, I think I'm in perimenopause. Okay, you can still get
Yeah.
pregnant. You still can.
Yeah.
It is very possible. But
That's amazing.
improving sleep really is key. Also, sleep supports melatonin production. So melatonin, we think of it as a sleep hormone, but it actually is present in the follicular fluid that surrounds your eggs. So it acts as a
Mhm.
potent antioxidant in the ovaries, protecting eggs from oxidative stress. And actually, research showed there was an IVF study that showed that women with higher follicular melatonin levels had much better egg quality and embryo development.
Oh, it's amazing.
And yeah, super cool.
Yeah.
Another thing that melatonin does is it actually improves or sleep improves insulin sensitivity. So if you're listening and you're dealing with PCOS, again, the root of that is blood sugar dysregulation. Sleep significantly improves that balance. So when you have poor insulin control, you have a higher androgens, and that disrupts ovulation. So again, better insulin control, better androgens, better ovulation.
Mm,
And then working on your sleep reduces cortisol. It helps with chronic stress, even though life was stressful around me, because I was sleeping, that was helping my body to handle it better. So, we
right.
talk about with our patients, it's really not about what your stress level is. I mean, you do what you can, but stress is always going to happen. It's really about how resilient you are to stress and how you're able to handle it. So
Yeah.
you really focus on getting that resilient strong where it's like, bring it on. I can handle it. My body is
Hmm.
resilient and flexible and able to kind of roll with
Yeah.
what's thrown at it.
I think that's a really, really good point to bring up how you were, thank you for being transparent about your stress levels being really high. And I think that's very common, especially for women in our 40s, because we're in that phase of life where some of us already have little ones at home. I know you had a toddler at home,
Yeah.
and well, he's a little older than a toddler now, but
Still act like a toddler.
and we have aging parents at this age that we're taking care of. You went through a massive life change, and so you were juggling so much. But I feel like that speaks to a lot of women in our 40s who are also dealing with major life changes or a lot of stressors, and kind of taking care of everyone around us. And
100%.
so I think it's so good to hear that you as a naturopath doctor struggle with it as well. But sleep is the best antidote for stress.
Yeah.
It's one of the things we actually can control
Yep.
in those stressful environments too.
Exactly.
So
And that's
so
one
I
of the
think that's a
first
really good
things we
point.
focus on with our patients is getting sleep dialed in right off the bat, because we know that's when
Definitely.
your body heals, is when you're sleeping.
Hmm.
Yeah. So let's see if there's anything else about sleep I wanted to mention. Sleep helps progesterone production. So if I have a patient coming in and she has low progesterone, I'm going to be working on sleep right away, because it does help to boost progesterone production when you get your sleep dialed in.
Hmm.
So a little bit of some cool stats. Women who slept less than 7 hours a night, if they were doing IVF, had 15% lower pregnancy rates than those who slept 7 to 8 hours. So just as simple as getting an hour more, it bumped it up by 15%.
Wow.
Night shift workers have a higher risk of menstrual irregularities and infertility. And then melatonin supplementation has been shown to increase fertilization rates in women with poor egg quality. So we will use this in our fertility protocols for some
Mhm.
patients. So
Yeah.
anyway, that was
Good.
my hormone
I
balance
love it.
piece.
I love it. I mean, supplements, you gave our audience such good supplements to, again, they work for you. So we would need to find what works for them individually. Optimal thyroid levels is really important. So getting that looked at.
Mhm.
Stress management, but also sleep, dialing in that sleep's a really, really, really big one. So these are
Yep.
so great. I would love to have kind of like a part two of this conversation and dive a little bit more into other strategies and some labs that you ran on yourself and things like that. And I think that would be really, really good. What would you leave our audience if there's a woman out there who is walking a similar path as you? What's one piece of advice you'd give to that future mama listening right now?
I would try to just flush it down the toilet, all of the messaging that you've gotten about fertility, that it has to do with age. It's age, 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 like
Yeah.
geriatric pregnancy, like all that stuff. Just flush it down the toilet, because I can honestly say that I truly believe that my fertility increased as I got older because I implemented a lot of these things. Like my cycles became more regular actually in my 30s and 40s than they were in my 20s, because I didn't know what
Wow.
I was doing. I mean, I at some point I was having a period like every 2 to 3 months in my 20s.
Wow.
You really have to just put on the blinders. Don't read the articles that have to do with age. Don't, unsubscribe from accounts that stress you out. Just put on the blinders, because you are, it's N of one. It's one person in the study, and the study is you. And
Mm,
work with someone that's going to do the right kind of testing and just have you believe in your body. And it is a process of surrendering. You do what you can and God does the rest, right? Like we can't
right.
determine the outcome. We can't control the outcome. It is a big loss of control, but that's a great lesson for us to learn, just to surrender to that and not have our happiness be dependent on the outcome.
Yeah, that's
You
so
look back on
good.
your life and go, why did I waste my life so dependent on this outcome determining if I am happy or
Yeah.
fulfilled? So just lean into the things that make you really happy, that give you joy, and that right there is going to boost oxytocin, and that helps with all these things we're talking about. Put on the blinders and just really try to protect your mind, protect your brain with this.
Yeah.
Work with someone that's going to support you, and just speak life over your fertility, and that your body is healthy and it's resilient and it's not broken.
Right.
That's
Oh,
what
that's so good. Dr. Well, thank you so much for sharing your heart and your journey so far with us. Your story, I know, has given a lot of so many women hope. So I really appreciate you sharing that. So to all of you listening, if this has touched you, please do share it with a friend who needs to hear this. And if you're on your own fertility or pregnancy journey, just know that you're not alone. We are here to support you in any way that we can as well. And so until next time, we'll continue this conversation in another episode with Dr. Noel, and we hope to see you guys all back here on the Dr. Lil Radio Show.